Hello, everyone. Welcome back to Talking Blondes. I'm your co-host, Virginia.
And I am Caitlin, and we are so excited to have you here with us today. And we are not alone. Anyone who's watching can see we have a special guest with us, Miss Sara Zwink. Welcome, Sara.
Welcome, Sarah.
Hi, I'm so excited to be here.
Thank you for being here with us. We're so excited to have you. We have another wonderful guest today joining us, representing the North Idaho area.
Woohoo!
Sara here is an upper cervical chiropractor, and we'll get more into exactly why that's specific because it explains a lot of her work and what she's doing. But yeah, and Sarah's a local here in North Idaho, and she's just really helping people with. I feel like Sara, not just with their physical being, but also their mental and emotional as well. You're just such a delight and a wonderful presence. And I think people also benefit from that as well with your care. So thank you for
Okay,
being
well, that's
you.
such a sweet way to kick this off, Virginia. Thank you. I think when you inherently work from like a nervous system lens, it could never just be the body or just mental health or just hormonal. Like it always has to be the full package. So
Yeah.
I'm happy that that is perceived from me as well because I feel like it's definitely one of the like you have to walk the walk. I can't just talk the talk. So yay,
Yeah.
I'm glad that's felt.
Yeah, absolutely. And thank you for having such a deep understanding of that too. This could be new for people, right? This sort of approach to their care and their well-being. And it's always reassuring to talk to somebody who has walked the walk.
100%.
Yeah, absolutely. But of course, there's been, I'm sure, a journey getting to this point in your life, Sara. And it's honestly so wonderful how transparent you've been too about it on your social media and, again, within our community. But could you tell us a bit more and our viewers about where Sara came from, how she got here? We want to hear all the things.
Yeah. Okay, wow. We'll try to do like the medium version, right? So I'll like reverse navigate it. So the way that landed me into doing what's called upper cervical chiropractic, so it's like brainstem-based care, is that I
Mhm.
actually got under this type of care. Mind you, I was already in chiropractic school, but I got under this type of care. And it was like the only and the last thing that fully stopped my panic attacks that I had been experiencing since I was 8. And I was like, what the hell is going on? Like just what?
Yeah.
And then that really helped me understand both from a mental health standpoint of like what can happen if we're operating from like a sympathetic dominant standpoint. So if we're basically like stuck in fight and flight and what that means for mental
Mhm.
health. But then obviously I was already like learning what that was doing to our physiology and our physical health. So that's what landed me like doing this type of care. But if I'm 34 now, so that I'm doing this for 6 years, and before that I was born and raised in Alaska, so spent the first 22 years of my life there, and
So cool. So
which is why
cool.
like North Idaho feels like Alaska light. Like yeah, I moved here first when I was 22, and I was like, oh, this is like kind of like Alaska, except for your winter is not as long, and you guys actually get warm in the summertime. So basically a win-win. So so at that point, I'd been interested in chiropractic in general when I was, I think, 20, just before I moved out of Alaska. And it was one of those things like my family was not on my radar as a child or as an adult. And I honestly did not understand it at all. In fact, I probably blatantly judged it, as understandably a lot of people can.
Mhm.
But I had like just finished traveling, and my friend and I had a friend who was a chiropractor when I was back home in Alaska, and I was 20, and she like Facebook messaged me and she's like, "Do you need a job?" And I'm pretty sure like quote unquote I was like, "I'm 20 and I just landed yesterday. Like, yeah, I need a job." Anyway, and so she's like, "Great, can you come into the office on Monday?" And she sent me this photo of this like 3-month-old baby, and I'm like, "Yeah, of course I can, but like what?" Anyway, so then I became her nanny. She's like, "Yeah, we this was February," and she's like, "We adopted this baby over Christmas. They didn't have kids prior to this."
Oh,
She's like, "This is a little bit harder than I thought. Can you be like an office nanny?" And I said, "Absolutely, let's do this.
absolutely. I can't.
Sounds
Yeah.
easy." But so I worked for her for like a year and a half, and it was one of the most cliche things where I started seeing people's lives transform coming into the office. And you kind of got to think of it this way, like even if you're coming in just for a pure like pain physical symptom, you're not showing up as your best self as a human if you're in pain, right? Like we all know this. Say maybe we're having a bad period, or you have a headache, or I don't know, your knee hurts or something. It's so hard to be your most gracious, regulated, kind, understanding self.
Mhm.
And I feel like, especially when I was 20, I was still very much like, I'm gonna change the world. And I'm gonna, how many of us feel, and once we get jaded a little bit, we kind of come back to it, hopefully in our 30s. That's how I
Yes.
feel right now. So I'm like, oh my gosh, this is my impact. Like I kept ringing in my head like feel good, do good. It's like a
Mhm.
really simplified way to look at it. And
Mhm.
so yeah, I worked for her for my early 20s, moved down here to start undergrad because I was like, I'm not gonna go to undergrad like in my hometown. That's silly. Like to me at this point, I was like, that's crazy. Anyway, moved down here, started undergrad, got to see how beautiful North Idaho is, then went to chiropractic school in South Carolina, which was a hoot and a holler. That was so fun. 'Cause I'd never lived in the South before. Um, and then I started my career actually in Dallas, so then I worked in Dallas for 3 years. And then
Okay.
I just moved back up to North Idaho, kind of full circle, and opened my own practice then, almost exactly a year ago. So that's the
Wow.
medium version of my life story for you.
Wow.
So at what
So
point, I just want to make sure I'm tracking.
yeah.
What, so you were also I love this. Like let's like rewind for 1 second and just pause. I love that you just like land and then your friends like, "Do you need a job?" Like that's like something out of a movie, you know? Also, here's my new baby. Want to watch her? Like
Right.
what? That
Yeah.
is amazing.
I thought so too. Yeah.
And definitely, I feel like that's kind of the magic of your 20s, right? Like things
Mm.
like that you just kind of
Oh,
embrace because you're like, sure, why not, you know?
yeah.
So you're in the office and you're watching her newly adopted baby. Is that it? And then you're observing all this? And then is that kind of how this all
So,
transpired? Okay.
okay. Yeah, so that's fair. So I started as the nanny in the office. And
Okay.
Mhm.
so for the
Okay.
most part, I would be like in that office 4 or 5 days a week. Sometimes I'd be at the home, but that also it was a small practice.
Sure.
As many chiropractic practices are. In fact, it's technically larger than mine is, but it was just herself and her one staff. And I quickly learned like how to run the front desk and how to check people in, and that actually
Okay.
yeah, I kind of skipped over a part. I actually, by the time I finished working for her, I became her chiropractic assistant. So I would like help do re-exams. I would help with things
Oh.
around the office as well as the baby like grew up a little bit and could have other support.
Mhm.
So then that really gave me, well, quite literally like hands-on experience of connecting with people outside of just like, oh, I'm the one over here with the baby.
Sure.
And
Okay.
it
Yeah.
was just like it was one of those things where I actually quite remember this one conversation I had with one of her massage therapist friends. And this massage therapist friend, I think would probably have been in her like mid 40s at this time. So I'm looking at her with all of the wisdom that, of course, she does have, but
Mhm.
especially, compared to me as a 20-year-old. And I
Yeah.
was like, yeah, I really love this experience. I really love chiropractic. I don't think I'll do it, like, but I'll probably just always be a really big advocate. And she was like, no, you're going to become a chiropractor because I've never seen someone relate to a skill like this and then not go and study and provide that skill. And I was like,
Wow.
that's like 8 years of school, and I'm 20, right?
Yeah.
Don't lock me down.
Yeah.
Right.
Yeah.
I'm an Enneagram 7. I was like, where's my escape route? So actually, you know what? As I retell the story, Marsha, shout out to Marsha, the massage therapist. I
Shout
should
out, Marsha.
find her and write her a letter because she was right. She
She
called it.
was right. No,
Gosh.
Sarah, honestly, you're giving like what some of us young 20-year-olds at the time we don't realize it.
Uh-huh.
But looking back, man, is it a blessing to have somebody like that, like a mentor, somebody who's like, oh, honey, no, we're getting you on
Yeah.
this path. And yes, we meet it with resistance. We're young, we just want to
Yeah.
have fun and not get locked down anything. But for someone to see us in that way, if we can't quite see it ourselves, is huge. It's an absolute blessing. So that is so cool that that's what ended up like kind of happening to you. Like it was just somebody's like, yeah, you can like mess around and take detours and all that to figure your shit out, or
Mm-hmm.
you can just get on this path
Yeah.
and it's going to be a really rewarding path. So what did it for you? Like just believed in her and what she was saying about you, or like what did it for you to
You
finally
know,
pursue?
I'm glad you mentioned that because I don't know that I've reflected much on that, but I do. I mean, thinking about it now, I remember literally like her comment was just stuck in my head. And mind you, this is now 14 years ago, and I can picture the scene. I know where I was standing, I know where she was seated, and so it really was like one of those like bookmark moments that I remember. Like
Mm.
I was like, how dare she say that? I'm not gonna do that. Why would she say that? And I was like, you're right. I fully met it with resistance, and then it just like festered. And then I was like, okay, well, like, okay, well, what does that process look like? And then I remember I would start like chatting with the
Mhm.
chiropractor that my friend, and I'd be like, so like, do you think there's like enough business for this? Do you think it makes sense? Like
Mhm.
asking these kind of like tiptoeing into the subject. And then what had happened, she was like, look, most schools will do some sort of like visiting weekend. Like, they'll cover your accommodations. You'll have to like fly down there, but sometimes they'll give you a travel credit. Like they'll do like an open house weekend. She's like, just like visit a school. And I was like,
Yeah.
and again, 20-year-old, I'm like, huh, well, that sounds like fun, sure. So 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 then I planned a visit to the school in South Carolina because it's what was highly suggested to me. And I had planned a visit to the school where my boss then went. It was in California, and I visited the South Carolina one. And I remember being like, I have to do this now. Like I can't. That was like the first level of like maybe that was like level two of like I can't unlearn what I just learned, and it resonated, and the space resonated, and
Mhm.
the people resonated, and it was like hurdle after hurdle kept like fading away. So much so that I came back. Now I had moved out of Alaska, quit that job, spent the whole summer traveling because I knew I was going to start undergrad here in North Idaho.
Okay.
Visited Sherman right around those same like 6 months. Visited the South Carolina school. I came back to now North Idaho, and I was supposed to visit the California school like 2 months after. I canceled that trip. I'm like, I don't even need to see the California school. I'm going to the one in South
Wow.
Carolina. I don't
Wow.
regret that whatsoever. I think just
Yeah.
because it was another trip, I should have just gone, but that's the only reason that I could
Mhm.
even fathom regretting that. So it was like, yeah, that's so interesting too that you mentioned that one comment that was made to me because it really did like plant the little mustard seed. And I
Yeah.
think that like I have never consciously reflected on what I'm about to say, but I think that it is moments like that that really have helped shape me into someone who, like, if I see something authentically in someone, that, like, I don't need to shy away from saying what I notice in them either, from
Yeah.
obviously, like, from a constructive, loving, supportive place. But it's
Right.
like, I really now have so much appreciation for her just being like, just shooting it straight. And she's like,
Yeah.
no, honey, you're gonna do this.
Yeah. No, I
And I think that's so great because I think that she has to have
agree.
so much authenticity and like knowledge of herself to be able to speak with that type of confidence about someone else.
Yes,
And I think like that's the shit that really resonates with me.
for
Clearly.
sure.
I
Yeah.
do think
I love
too
that.
that moments like that in life, like you're talking about how, a lot of things just kind of seem to fall into place.
Mm,
Um, and I think moments like that in life are very rare. Being just 20 years old too, or, around your early 20s, I don't even think we realize when we're in that era of life how rare of an opportunity it is. So
Mhm.
kudos to you and shout out to you for actually taking a chance on it and investing and believing in yourself.
Yeah.
But also, moments where we do have that person, to your point, Virginia, that is a mentor or some kind of an advocate for ourselves and is like, no, I see this in you and you're going to do
Mhm.
it and you're going to kill it.
mhm.
I mean, wow, like what an amazing way for this kind of all to unfold into a career. That's so cool.
Uh, Thank you. Yeah, and it's definitely one of those things where you look back and you're like, oh, I see the dominoes.
Yes.
But until you like pause to reflect on it, sometimes it can end up feeling like happenstance, but also like, no, there was a path. It makes sense now.
Yes. Oh, that's so cool. I love that. And when by the time, Sarah, you went to your undergrad
Mhm.
school, at that time, were you managing your mental health? Were you still dealing with panic attacks? What was that like for you? You're like, oh,
Girl, I didn't even know. I didn't even know to call it anxiety or panic. I was just like, I don't know. Sometimes my body shuts down and I can't stop shaking and I have to feel like I have a heart attack and then I'm gonna throw up and then I'll feel better. Is basically like
wow.
because this started when I was like 8. And
Yes.
so I was so young that I just like learned. I remember just thinking, okay, this is just how my body goes through the world, which can be true. Like our
Right.
bodies go through the world differently, right?
Yes.
Sure.
Um, and I my I had like a friend who had had a seizure, and I think that that's how I remember it. And so I had understood that this friend had had a seizure, and then I remember my panic attack starting. And I remember like one morning I woke up and I was like, Mom, like, do you know when you have a seizure? And she's like, No, sweetie, you're like, it's like you're sleeping, like you don't know what's happening. I'm like, okay, cool. So in my mind, I'm like, okay, I'm not having a seizure. Because what
Okay.
essentially was happening was like this adrenaline dump within my system. For whatever reason, that my brain was like overactive from a essentially protective state. And I kind of laugh about it's not the right way to put it, but like on paper, I had a very like safe, loving childhood. So it is one of those things that it's like if there we truly can never actually compare people's trauma because it's a question of like what does your individual system have capacity for?
Right.
Um, and so at this point now, like in undergrad age, like 2021, 22, because I started a little bit later,
Hmm.
um, oh no, they were still full-fledged happening. And like and sometimes it would be like a response to something, and sometimes it would just be like, dude, I'm living my life. Like, what in the hell?
Yeah.
And but it was just like something I mean, yeah, I had lived it for like what is that, like 14 years at that
A
point.
long
So
time.
I would just like ride it out and then move on.
Because that's all you really
Because all I knew.
do. Yeah. And
Yeah.
survival mode. Okay.
Yeah.
Okay.
Yeah.
Did it get to a point where it was really interfering with like your quality of life, or what did it take for you to finally go, I need to do something about this? Like,
Wow, Virginia, what a beautiful question because that I have I was about to say I have a stupid answer for it, but that's not true. But did it interfere with the quality of my life? Absolutely.
yeah.
Absolutely. Because I remember if I were to like go out and drink, even like
Mhm.
I'm not saying like get trashed. I mean like have a couple drinks and maybe end the night with a hamburger. That was like a
Mhm.
recipe for like me going home and having a panic attack. It was like too much stimulation, too much something for my system. But then
Okay.
sometimes it'd be like if I had had a bad argument with my then partner, then that would trigger it. And then sometimes it just wouldn't, like there wouldn't be a logic to it, which kind of
Mhm.
puts it more in the panic side of things. So
Okay.
yes, it was interfering because I started creating this anticipatory anxiety of like, I don't know that I want to go out. And I also think that I was in my first like long-term relationship at that point, and it very much put me in this like what do I need to say or do to not trigger this other person? So now I'm assuming the responsibility of someone else's emotions. So
Okay.
on this side of it now, 12 years later, I recognize I'm like, oh, we were fawning, we were in sympathetic dominance, we were struggling with anticipatory anxiety. So
Mhm.
in the moment, no, I was so deeply dissociating from how much it was impacting my life. It was
Okay.
truly when I started some therapy when I was in chiropractic school, and then when I started healing in different levels, and
Mhm.
also predominantly, honestly, just academically learning about the brain and the system, there would be times in class I'd be like, oh fuck, I think that's what's happening to me. When I'd be like learning about different things.
Yeah.
And I thought, and that was very
Huh.
slightly jarring because then it was like making me sit with what was my reality as opposed to just like, we don't talk about that dark thing that happens.
Right.
And so that was interesting and then like frustrating at first. And then the more I started learning and started getting under this type of care and started getting better,
Mhm.
that was like level three of like, oh, like I said, I can't unsee this and I can't unlearn this. And I think that I I don't know what other way I ever would have. Well, who's to say that there's an infinite amount of realities out there. And
Yeah.
also, like, I don't know. I genuinely think I probably would have just disconnected from it from the rest of my life. Something else would have had to
Mhm.
brought it to my attention.
Mhm.
And to be honest, speaking from like a healthcare professional and understanding the brain and body as I do, I'm willing to bet it would probably just start manifesting in even more severe health struggles until my body was screaming loud enough for me to listen to it. Because as especially we're learning about like women in trauma and autoimmune, like I really feel like I was like on that fast track. And then
Mhm.
I'm just very grateful that like the life journey I took was a hard interruption in that in a healthy way.
Yes. Yeah.
So there's that.
There's that.
Yeah.
Yeah.
So when you're
Yeah.
learning about all of this and everything, at what point do you kind of decide, okay, like I need to do something? Like or maybe there's some action I can take, towards my anxiety and panic attacks and things like that. Was there like an aha moment or, I'm so curious and what types of I guess, treatment or, I don't know, therapy or anything like that, what seemed to help you most on your journey?
Yeah. The aha, and again, this is where I feel like my journey was almost a little backwards because I essentially like accidentally started getting better. I got under the type of care I now practice because I really liked the doctors who were practicing it and who still practice it. Because I was like, I have three brothers, but I still say I'm the eldest daughter because like all of those cliches really deeply apply to me.
Yeah.
And I guess, as the only girl, I am the eldest daughter.
Hmm.
Um, and so I was going to like all the seminars at school and I was learning about things. And I remember thinking like this one group of docs, I like really like how they show up because you can tell they like know their stuff, but also they just like sit down with their notepads and they're like ready to keep learning because we are all forever students here and there's so much to learn
Yeah.
and so much new research coming out and all the layers to it. And so I had known some students who were like shadowing those types of offices, and I started joining them. And I just remember at some point I had made the connection that when I got under this type of care, I like the things that I knew would trigger these
Hmm.
episodes, these panic and anxiety attacks for me, such as like the going out or having an argument with the partner, stopped triggering me. And that was like the only thing that had changed, right? So
Hmm.
it was a little happenstance in the sense that like I would be in like we didn't have many psych classes because that's not what we do, right? But like I would be learning about it academically, I'd be experiencing it personally, and then there was like one particular conversation I had with um one of the docs and I asked her, I was like, hey, so quick question, like could this have anything to do with like anxiety? Like does that make sense? And she was like, oh, I'm shocked if someone on our intake paperwork starts by checking the box for anxiety and then on the re-exam doesn't tell me, oh, and also like this is doing better. She's like, I'm shocked if they ever tell me it's not. Because and then like breaking down like the impact of the brainstem, the brain, etc. Now,
Oh.
so I just remember that conversation being like, oh my God, I think this is like what's helping me. Because not again, nothing else had changed. It was the
Wow.
only variable.
Wow.
Now, with all of that being said, understanding that like
Mhm.
there are so many nuances when we talk about anything mental health related, right? Like, you guys both get that.
Mhm.
And especially with anxiety. So it's not that this was like a replacement for some kind of classic talk therapy that I'd been in or for other somatic
Right.
work that I had done. But it was like, let's at least make sure quite literally like physically there's not something essentially irritating your brain by irritating the brain stem, which is like
Mhm.
one of the biggest deciding places of like, are we going to be in fight and flight or are we going to be in rest and digest? And
Mhm.
so it was like when I incidentally started this care just because I liked the doctors and I
Yeah.
was like, I don't know, I want to learn. I'm like halfway through school. And then I started getting better and then that was the snowballing, like the tipping point to me being like learning more brainstem things, learning more vagus nerve things, learning like
Oh.
how trauma can impact the brain and body and like learning just everything in this whole realm. Like where
Mhm.
is talk therapy's place? Where is coaching's place? Where is somatic practitioner's place? Where is
Yes.
breath work? Where's meditation? Where's yoga? Where does pleasure fall into this? Where does
Mhm.
nutrition fall into this? Like where does my like upper cervical so brainstem-based care fall into this? And so it
Mhm.
is a whole ass pie,
Yes.
but I had just incidentally, consumed one piece of it. And then I was stuck in it forever, and here we are.
But it sounds like that one piece was like a force multiplier for you.
100%. Yeah.
Yeah.
Yeah. And that's why I'm like, I really don't know that I ever would have landed in this world at all had it
Yeah.
not been for that one piece of it for me. Yeah.
Yes. So from that piece, maybe like over time, then you probably got into like the other ways of treating mental health from a
Hmm.
holistic and clinical standpoint. So is that kind of
Yeah. Yeah.
that like over the years or over time?
Yes.
Okay.
100%. Because I think that I co-manage with therapists a lot, right? Because again, I
Mhm.
am like the physical portion of it.
Right.
And people, by all means, any sort of service provider, be it a massage therapist or a chiropractor or a hairdresser or something, we know we're like accidentally, incidentally, essentially someone's therapist, just at least from like a what they're sharing with us. But
Yes.
I also very much know like that is not my lane. And
Okay.
I didn't study the skill set to know how to like what to say to you. I can share about my own personal experience if that feels appropriate, or I can share like somatic tools as appropriate, but I can also very much hold space, but then also share other professional resources. So it was like some of the very like quickly then adopted I would say practices were like different breathwork tools because I still use
Mm-hmm.
them. And it's like understanding it's not about how often can you get adjusted. In fact, quite the opposite, but it's understanding like there's this whole breadth of a ways to approach the brain and body and nervous system. And sometimes we have these tools and sometimes we have the other and sometimes we have
Yeah.
none. And so yeah, I quickly opened this like open up the floodgates to conversations. Very, I would say the most common ones are like breathwork based tools,
Mm-hmm.
Okay.
and then just like other vagus nerve based approaches. And the vagus nerve, again, like that funnels right up here to the back of the neck at the brainstem, enters into the brainstem. And so like it's an extension of it. So it's like when
Mm-hmm.
people talk about vagus nerve things, I'm like, that's amazing. And also, what if there's like literally irritation at the place that it's supposed to talk to the brain? I wonder if that could have a play, right?
Mm-hmm.
Um, so yeah, it's like this, it's like I said, like open the floodgates. And now,
Yes.
yes, there's like one main thing I do, but I'm also always trying to, my goal is to like, I always say my goal is like put myself out of work. It's never going to happen because there's so many people and so many people get injured or have a car wreck that then exacerbates something or are finally ready for care. I think that's a big piece of it too, is I do really see you have to be ready and open to heal.
Mm-hmm.
And not everyone is, and it's not the right time for everyone.
Yeah.
And so my goal is always to like I like dismiss people from care all the time. Ideally, that's the goal, because they shouldn't keep needing me if it works, right? But that doesn't mean that I'm not helping supply them with more supportive things along the way. And most people will like check in, like I don't know,
Mm-hmm.
every couple months or so. But it's like then we talk about are they feeling like they need extra in the moment tools, you know?
Yes.
Sure.
Yeah.
Because there's so many.
Yes, there are. And I love though that's your whole like I don't want to say like business model because I know you also deeply care about your patients, but it is your business model. You
Yeah.
pretty much have this program, you put this treatment program, you put your patients through so that they are able to pretty much manage their symptoms on their own from after a certain duration of time of working together, as well as providing tools. So I'd love to talk more about that. But Caitlin, did you have any questions for Sara?
Yes, but I think it might be good to dive into that first, get into that,
Okay.
because I think mine will kind of bounce off of those. So
Okay.
let's dive in, girls. I'm here for it.
Perfect.
Yay!
Let's
Yay.
go.
Okay. Yes, Sara, please talk to us about your treatment program and what it
Okay.
entails and what does it mean for just us average people listening.
So you kind of nailed it on the head there. Is that yeah, I think I said that right.
Yes.
I was like, sometimes I'll be flipping phrases, man.
You want to hit my
Um,
head.
you nailed it.
That's part of
So yeah, there
your
is
treatment
I work with
program.
that's actually part step one is right now. So I tend to work with people for generally speaking 6 to 9 months. Obviously, everyone's duration can be different, and it's not a 6 months of straight the same thing for everyone, right?
Mhm.
But first step, actually, I'm going to step out of frame so fast, and then I'm going to be right back.
No, you're
First step is the
fine.
scanner thing.
Okay.
Ooh,
So
what do we
this is
have
Okay.
here?
This is actually infrared thermography, and I call this functional nervous system testing because it's essentially showing me, is your body able to come back down to like homeostasis? Is it able to calm down, or is it stuck in this like overactive state? And so I'll scan someone's neck with this multiple times, and I'll compare the scans, and we'll see like, A, is there balance within the scans, and
Mhm.
B, is the scan changing? And so I had initial exam today. Put this on the floor. I had an initial exam today, and we because first step's always like, hey, let's make sure what I'm focusing on, like structurally at the brainstem, let's make sure that's actually your problem, right?
Mhm.
Because it's not. Just because someone might have migraines or vertigo, panic attacks, those are like, or POTS, those are like the four kind of main things. Doesn't mean that this is happening in their system, but you know what? Especially if we've already tried the gamut of things to do, we should probably look. And so
Okay.
first things that initial exam, right? We'll run the scan a handful of times. And like I said, for example, my new patient this morning, we we did a scan, then a range of motion, then another scan, then some orthos, then another scan, then a postural exam, then another scan, and then chatted some more, then another scan. Then we took X-rays because now if I see that imbalance and that consistent imbalance in the scan, now I want it.
Mhm.
Now I'm seeing that your body can't really come down to balance, like it's stuck in an overactive sympathetic dominant state.
Okay.
And now I want to see like, okay, is there actually something structural? Like, are some of the vertebrae that house and protect the brainstem, is there an issue with the way they're moving, right? So I take them to the X-ray suite and we take imaging because this area is so neurologically sensitive. Like, I want to know what I'm doing before I'm going to touch it, right?
Yeah.
And so we took X-rays. I haven't analyzed them yet because again, this is just a few hours ago. But also, mind you, I have been doing this for this summer this fall is 6 years. And so like I can tell just by the way that they were able to tilt left, or rather like not tilt left very well, and the way their jaw started like moving funky, so to speak. I was like,
Oh,
oh, okay, we have a movement issue here. I don't know what it is yet, because again, I haven't combed through them, but I know something's not moving correctly. And then
okay.
we came back to the office and did 2 more scans, just of the neck and of the full spine. And one of the things that stands out to me is the neck scan, like, stayed so, so, so similar in between all those first things we did. Went to a whole nother room. They were feeling kind of overactive in their state. Their scan actually wasn't showing the stress, which that's actually not a good thing. I would almost rather, because think about it, sometimes our system should be stressed. Sometimes
Yes.
anxiety is appropriate.
Yeah.
I
Yeah.
want you to be able to respond to something stressful so that you can survive. That's the whole point. But then I want you to be able to come back down to it after, because we're not supposed to live in that
Mm,
protective response. And so even
okay.
though even though they were like feeling stressed internally, their scan wasn't changing, which is actually not great. And that's actually part of the
Mm,
problem and why they're here, because what do you mean your
Okay.
system was essentially frozen?
right.
And
Right.
so that's like the big picture here of step one. Let's just see between the scans and the imaging, is there even an issue at this level?
Hmm.
If I've checked both those boxes, then it's like, okay, now we can get to work. And that's where kind of like now we start the program. So the first whole
Okay.
phase of it, 12 visits or so, is predominantly like I don't give them homework, I don't introduce other things to them. I just want to see how does their body respond to this treatment.
Mm,
Because again, it's so sensitive.
right.
And oftentimes there's like a couple different areas that might not be moving ideally. And I'm only ever going to start with one because again, variables. Like I don't want to know. I don't know, was it the first, the second, or the third adjustment that did it? I just want to know, is this one working or is it not? So we have to
Yeah.
give the body some time.
Okay.
And then once we've stabilized and they're able to, we would say, like hold the adjustment, like they don't need an adjustment when they come through because the body's still balancing via the scan. Like we're changing, we're balancing, and we're not in a stuck frozen state.
Yeah.
And we're seeing that consistently. Then that's where we're going to start adding whatever tools they might need. For some people, it might be more like structural retraining. For other people, it
Mm,
might be more like vestibular tools. For a lot of people, these are some like the anxiety and somatic kind of tools that they might not have had the instruction on previously. So
yeah.
that's where like the program really starts becoming so much more personalized because, everyone's story is different. Their
Right.
body's
Sure.
expressing the stress differently. And
Sure.
so my goal by all of the end of it is that I'm seeing their system consistently not need an adjustment. Ideally, I don't adjust you. I only have to adjust you when something's wrong, right? So
Hmm.
the goal by the end of it is that you don't need an adjustment. Most people, again, will like check in once a month, once every 2 months. Let's just make sure, you know, I don't know, car
Hmm.
accidents happen, hits to the head happen kind of thing. Let's make sure things are maintaining. Um,
Yeah.
and then also like, again, to continue their own snowballing effect of healing, like, do they need other, do they need practice
Oh
Oh no,
no.
you're good.
Oh, we're good.
over?
Nope. We're
No, you
Okay,
are good.
I'm on Do Not Disturb, but a FaceTime, but my bestie just surpassed it because she just
my
FaceTime through.
bestie just
And
surpassed.
then
That's why
she
she
does this so
surpassed
often,
you.
by the way. That means she
This
didn't
is
check my location
great.
to see I was at my office.
Oh,
And then I
come on,
tried to press no,
bestie.
but I pressed yes. Okay, cool.
We're good. We're good.
All right.
I
Well, anyway,
actually, I actually have.
yes.
We're getting to some of my questions for you, so this
Okay,
is good.
good.
I mean, I have a ton, but this is actually like a good potential segue for me. So,
Yeah.
and this is kind of coming from more personal experience from my I get really bad migraines, and I've
Hmm.
talked about this before in some previous episodes we've had, but it's very it's very interesting because I swear, and my mom is the same way. If there's something genetic, I don't know, or maybe we're just crazy. It's probably a mixture of both. But honest to goodness, a lot of the tension is in our necks. And
Hmm.
however, on top of that, I also have some TMJ. So I heard you mention, like things about just alignment in general, and I think you might have even said something about the jaw as well. But I swear, and tell me if I'm crazy. I'm probably crazy, but I swear, when I go to bed at night, I swear it's like my neck, either, I don't, obviously it's not like changing its shape or anything, but it feels so different when I'm laying on my pillow. And if I'm not laying a certain way, if I don't use a certain pillow, if I'm not at a certain angle, I will wake up in pain.
Mhm.
And I'm just curious, and I know there's obviously, short of me coming out there to Idaho and having you look at me, there's not much you can do right now. But I'm curious, have you treated anyone, with TMJ, or, just, of course, you've treated people that have neck issues and things like that, but what are things that you've done for people that might have, migraines, or, it's all, to me, a lot of it's all related because I do have anxiety, and I have, really faced, depression in the past and things like that. And I know that I store a lot of that anxiety often in my body and I don't even realize it.
Mhm.
So I'm just so curious. And I know we could speak about TMJ and migraines for hours. So we don't even need to
Yeah.
totally dive down that rabbit hole. But, I'd love to hear even a little bit about your experience with that while we have you.
I hate that that's your reality. But I'm so glad you asked about it because the doc that I worked with in Dallas, he almost exclusively works with migraine patients. Because, and
Really?
again, you're right. We could go off about this for so long. I will shorten it into this. Not only, yes, can there be like irritation at the brainstem itself, which again is one of the biggest deciders in the state of our nervous system, but also there's other factors going on at this level. So we also want to see things moving correctly because if not, we can be inhibiting proper CSF flow. And a lot of, not everyone, but a lot of my migraine patients, like when a storm comes in, that tends to be triggering to them. And
Yes.
so,
Yes.
okay,
Mhm.
I'm not
yeah,
crazy. Okay, yes.
no, I promise you you're not. And you know what? And I kid you, this literally was this morning, and most of the time I have an initial exam, people are like, I don't know, maybe I'm crazy. And I'm like, I need you to understand. Crazy to you is normal here.
Yeah.
Like this
I
makes
love
sense
it.
to me. So you might
I
be
love it.
crazy outside of this, but not in this
Right, right.
context.
Right, right.
Can't vouch for you outside of the office. But anyway, but so what we tend to see in migraine patients is right, irritation at the brainstem, keeping it in
Yeah.
that like sympathetic dominance. We know based off of upright MRI studies is that if something's not moving here appropriately, like especially for people who played a lot of contact sports or ever cheer for women is one of the big cheer and gymnastics, but a lot of sports or different car accidents. Sometimes there's not even an accident that we can remember that was like a big concussive incident for us. All that being said, it negatively impacts that CSF flow, and that spinal fluid needs to be able to clean and feed the brain. Like it's supposed to be circulating in the brain, around the brain. The brain's floating in there, right? And then flowing out through the spine, up and down, kind of constantly, especially when we're sleeping.
Mhm.
And then also like venous flow to and from the brain, like the blood to and from the brain needs to also be flowing correctly. And so there can kind of be like this perfect storm for migraine patients, to where like many of them, in fact, especially if they have sat down in my office, like they've already had an MRI and they know that nothing like nefarious is going on. And they've already kind of gone through the gamut with their neuro of like, look, we're avoiding triggers and we've tried a couple different meds and like maybe we've gotten better to some degree. And also like, I'm sorry, this is the cross you have to carry. And I don't accept that. Only because I do consistently see a better reality for people when it comes to migraine sufferers. And so I
Yeah.
am glad you brought that up because it is sometimes honestly like clinically frustrating to me that I feel like the road kind of ends for so many of you here. And I'm like, no, the road actually continues. But
I love this.
again,
I
like
love
I
this.
am in a minority field and and even within a minority field, I do a specialty of it. So it's like I can't blame anyone for not knowing. But so often I see kind of like the gears start turning and someone's like, I do always feel it in my neck. And
Mhm.
then they'll like share the other points that make sense. And to your TMJ comment as well. Yeah, because we have to think that one, the nerve supply to the jaw and to the muscles here comes from the brainstem and the vagus nerve, the facial nerve, glossopharyngeal nerve, all these things that come to the brainstem. But also, like when we think of like taking a bite of food, it's not that we only move the jaw. Like, like if you take a bite of an apple, it's not like just the jaw.
Mhm.
It's like this whole like dance of movement. And so if things aren't moving correctly here, the jaw has to compensate for it. So no wonder that if that's going on in your system, I'm not surprised when people come in with jaw tension, teeth grinding, snoring, but like
Mm-hmm.
TMJD as part of
Hmm.
like their litany of things that they are struggling with.
Yeah.
So there's
Yeah.
Yeah.
that.
There's that.
Yeah.
Seriously. That gives me a
Yeah.
lot of hope, girl. Thank you. I
Good.
honestly.
As it
Um, Go
Well,
ahead. Go ahead.
as it should, I was going to say, and like by all means, please do fly out to North Idaho and visit because you seem so fun. But also, like, just know I will be DMing and seeing like where you are and seeing if I can find a practitioner who can help you because I'm not the only person who does this work, right? You know, so
Yes, but
yeah.
I want you. I've already decided. So
Well, okay,
I'll
as
book
you
my
should.
flight and we'll all get drinks and we'll hang out and then I'll book an appointment. We'll be good.
We
We'll
can
be
do an
good.
intensive weekend. I have people do that sometimes.
I
Yeah,
love this. I love
yeah,
this.
That would be amazing.
Well, I
Sarah,
don't want to
going
get
back.
us
Oh,
too off
yeah.
track with just the migraine talk. I just wanted to ask selfishly
yeah,
for me, but also because I know there are millions of
Oh,
women
yes.
out there and men, of course, but our audience is mostly women who suffer from those. So it's always
Yeah.
interesting to get some, an expert's opinion when you are seeing people who deal with these things.
yeah,
Hmm.
100%.
Yeah.
No, I think it was worth noting.
So, Sarah, going back to your treatment program, it sounds
Mm.
like there's a portion of it where you get your patient back to this balanced state,
Hmm.
is what you were saying.
Yes.
Yeah.
And then once you feel like you're achieving that with your patient, then you introduce other tools and like maybe modalities
Hmm.
to help them throughout the rest of their program. Is that kind of like the gist of it?
Yeah, about. So the first goal is to just get them out of that stuck state towards
Yeah.
balance. And then as soon as I'm seeing that even if we're not balanced, but at least we're changing, then that's where we
Hmm.
might start adding in different homework. And so I, here in the
Okay.
office, I only do upper cervical chiropractic. So I don't do any other sort of like treatments. But there's
Hmm.
so many conversations to have around this. Some of the main like starting points are probably breathwork related, movement related, diet related. And again, I'm not combing through and perfecting their diet. One of the first square like starting points for women is just making sure they're actually eating enough, like eating
Yes.
enough. Even for
Yeah.
those of us who like quote unquote can stand to lose weight, we probably are
Hmm.
still actually not eating enough. And what's happening when that's happening, that's also like consistently sending a stress signal to the brain because the brain's like, dude, we
Right.
must be in a famine. I should probably be worried right now,
Yeah.
right? And so it starts with some of these kind of more macro conversations, oftentimes, because
Hmm.
I feel very confident in what I do, but I'm not going to comb through your blood work and tell you exactly what you should be eating. Now, my friend Carmen next door can do that, you know?
Yeah.
So it's like where might you need external help from another practitioner, and also where might we just need to learn a couple different tools of diaphragmatic breathing, or start doing some like free writing journaling and letting some catharsis
Mm.
happen, or oh,
Okay.
you haven't seen the midday sunshine in 4 years? Okay, I wonder what 10 minutes does. You know,
Yeah.
so it's that's where it's pretty individualized because everyone's life and symptoms are going to look different. But then it's
Okay.
like once I'm seeing if there's at least change within the scan and the system, now it's like how can we capitalize on that? And now that I'm seeing more
Hmm.
capacity within your system, how can we help support that capacity so that we can get to the balanced state, not just faster, but also more, like almost more stable.
Yeah.
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 That makes a lot
No.
of
Yeah.
sense.
Hmm. And these adjustments that you do, Sarah, they are specific because it is a
Hmm.
specific part of the body. But
Yeah.
your objective is to get the spinal fluid moving, as you were talking about. Is that part of it, or just
It's
to
part of
get?
it.
Okay.
Yeah, it's one of the things that is I wouldn't say that's the objective just because that's not um like I'm not measuring that. I'm not doing MRIs here in the office, but
Okay.
what the objective is to essentially like calm down the brainstem irritation. And I do that just by
Mm.
making the way that I do that at least is just by making sure nothing's stuck at this area. Because again, like I need it to move correctly any which way you're moving.
Hmm.
I don't want it you're tilting right and all of a sudden it's triggering it more because it can't move right, right?
Mm.
So I want to make sure we're reintroducing movement at the right time, which is why I use the scan, and then in the right way, which is why I have the images. And then from the spinal fluid, from the blood flow standpoint, we just know how that's being impacted because of it.
Okay.
Okay.
Yeah.
Yeah,
Okay.
that makes sense.
Yeah.
And
I
this,
feel like I
oh, go
am one of
ahead.
those people who like I really love what I do. And sometimes people ask me questions. And I just did this
Sometimes,
the other week. And she's like, and also like, could this have anything to do with it? And I'm like, are you tired of me having an answer for everything you're saying yet? Because I'm not saying that that means I'm the solution to everything you're saying. I'm just relating like how this
right.
plays into the nervous system and what that could do if we're stuck in that
Mhm.
fight and flight. And it's like,
Yes.
this is, sometimes I'm like, God, I wonder if I'm obnoxious. And I understand that's not my responsibility. But I am like, I'm just sitting
No.
here like smiling and people are telling me like about their struggles. And I'm like, I'm so sorry. I'm grinning like the Cheshire Cat in front of you. I just get so excited when I'm like, oh my gosh, I can help you. You know, it's the coolest thing. It's like, oh my gosh, everything you said, you must be in the right place. Let's find out for sure, you know?
No, but do you
So anyway,
know? I'm sure you do. I'm sure we can all say we have been in an experience where we're getting, healthcare and we're asking someone questions and we are getting monotone at best.
mm,
And if not monotone, they're often being rude, or they're acting annoyed. I can say, I just had an experience about a week ago where I got that. And you were saying this earlier, Sarah, when you were saying, if you're needing to be seen, odds are you're not your best self. You're not thinking clearly. You don't feel well. So the last thing that you want is someone who's gonna act like they're going out of their way to answer your question, or, it's this, like I
yeah,
think it's refreshing to have someone who is so passionate about what they do, and positive about what they do. That is, we
Mhm.
need more of that. Like, if
Yes.
you're listening and you're in healthcare, one, God bless you, but two, please, please, please try to do this. We need this. Like,
Me
it is
too.
hard to find this,
Yeah.
at least in my area. I don't want to speak for everywhere. And there are a lot
hmm
of great healthcare workers out there, and I'm rooting for all of them. But we need more of this. So
hmm
I
For
love
sure.
it. Um,
Well, I appreciate that. Thank you.
oh, of course. I know you kind of got to this, but
Mm,
maybe even dumb it down for me a little bit more. In the words of Michael Scott, right? Like, explain it to me like I'm five, right? So, because
perfect.
I know that there's probably people listening out there who are like the mental health nerds like I am, and they just love kind of hearing how everything connects in the body and everything. So, when we're talking spinal fluid itself, can you
hmm
break it down a little bit more with the correlation between that and then just how it impacts things like anxiety, maybe depression, the nervous system in general?
hmm
And it may be that it could be a super long answer, and I didn't mean to totally put you on the spot, but I just feel like that's something that I don't know. I'm super curious myself. I'd love to learn more.
No, thank you for asking that. I think one of the main, let me backtrack for a second. So that's really going to
Sure.
be like where the brain stem has a bigger impact. So the spinal fluid
Okay.
is what the brain sits in, and it's also again what feeds and cleans the brain. And so we want to make sure it's circulating correctly, which is why I'm looking at the movement of the top of the spine because that could essentially get in the way. But when that gets in the way of the spinal fluid moving, we also know that that can create pressure at the brain stem. And the brain stem is like our kind of super highway of information from the body to the brain, but also from the brain to the body. So when we're talking about like a mental health standpoint with this, we also have to think about, well, not quite also, but I guess square one would be thinking about like when we're talking about anxiety, obviously a lot of nuance, a lot of context, but so let's go ahead and like have the permission in this conversation to make kind of some blanket statements. One of the things that I
Sure.
know I experienced about with anxiety, and many of people who come into my office notice, is they might notice racing thoughts, racing heartbeat, shortness of breath, kind of like tingling sensations within their limbs, sweaty palms, etc. So when we look at, so that might be what they notice within their body in a moment of heightened anxiety. Okay, when we look
Mhm.
at physiology, so physically in this body, what is supposed to be happening in a protective response, those are also the things that are supposed to be happening. I want my heart to start racing so I can keep that oxygen going to the rest of my body. I want
Right.
the breath to be faster so that I can keep refreshing that oxygen. I want my mind to be racing because I want to be thinking of every possible survivable outcome. Like, where are all the proverbial exits, right? So in
Right.
in an
Yeah.
actual acute moment where my survival is being threatened, Those are great responses. I don't need to worry about digesting food right now. Screw that. We'll do that later. I want to make
Yeah.
sure my limbs can move.
Mm-hmm.
The question then, and I love the memes like this, 'cause I can relate, is like, I wish my body wouldn't confuse a bear with an email or
Yes.
or like a bear with a missed call. Right. So
Mm-hmm.
then that's the
This,
question.
this.
Exactly. And so when I talk about mental health in particular, I'm approaching it from where's like the Venn diagram of the what's happening physically in the body compared to what you're noticing in the moment when you're noticing increased, say, anxiety. Because if there's a strong overlap, then I want to know, is there something at kind of that command center of should I be in fight and flight or should I be in rest and digest? Is there something almost like over triggering that area that is kind of keeping us in fight and flight as opposed to letting our
Mm-hmm.
body like actually calm back down? So that's kind of where it again, like Venn diagrams into the mental health field is because the mind and body, they don't act separately, right? I mean,
Right.
one of my favorite examples is like if you get embarrassed, what happens? Your cheeks flush. Okay, so now we
Mm-hmm.
have a physical response to an emotional experience. Okay, the
Right.
mind and body aren't separate. So is it always 1 + 1 = 2? And like if you have anxiety, then for sure something's wrong with your brainstem? No, of course not. And
Sure.
if you
Okay.
have anxiety and it's happened for a reason for a long time and it's not logical with what you're experiencing in the external world, like there's no actual threat right now, and we're having stomach issues and our body can't and we can't sleep at night, like our body like doesn't know how to kind of shift down, and I'm noticing this racing heart and racing thoughts. I'd be curious, and again, mind you, panic attacks for almost 20 years. I'd be
Mm-hmm.
curious to know, like, is there literally something physically demanding that your brain stays in a heightened state of awareness?
Okay.
So that's the
Okay.
tie-in. That was probably
Okay.
more than a 5-year-old.
Just a
But
little.
I'm thinking freshman year, you know?
Maybe even
Great.
maybe even middle school. We can work with that. We can work with that. No, that was
Yeah.
great. Thank
Yeah,
Okay,
you.
that was
cool.
great.
Yeah.
What stood out to me was, Sarah, what you were saying about for patients who you might be struggling, with their mental health and like anxiety, that when you realize that the brainstem seems fine,
Hmm.
that there could be other factors at play, is that something to an extent you can also work with the patient, like you would still try an adjustment just to even see, or like what would your approach be to a patient whose brain stem seems to be fine and they're not?
I wouldn't take them on as a patient then.
Okay.
Yeah.
Kind of
Yeah.
figure
Okay.
okay.
Yeah.
Okay.
That's where I would refer out to likely then if they don't already have some sort of like emotional support psychotherapist, coach, etc. That's when
Yeah,
that step would be more appropriate.
gotcha.
Now,
Okay.
so it really is like step one and then supportive
Hmm.
tools, but
Sure.
it's not the opposite necessarily. Unless, well, I guess sometimes people might start with all of the supportive tools and then if they're finding if like because one of the things I hear a lot is like, look, I'm doing everything. I'm doing the breath work. I'm trying to meditate and it's still not working.
Yeah,
Then okay,
Mm,
yeah, let's look to the brainstem. But again, like if I'm not the place for them, then I'm not the place for them.
sure.
yeah,
Yeah.
Sure.
that makes
Yeah.
total sense. With you personally, Sarah, when you got chiropractic adjustments
Mhm.
done, did it show up that your brainstem was, like, I guess, out of place, or just not, like, what did that look like in your own imaging and
Mhm.
x-rays? Or was that
Yeah.
part of your experience?
It was because I started I started as a patient of the type of care that I now do. So that's where like yeah, we first started with infrared thermography and we're able to like see that it shows up as 3 lines on the computer and ideally they're like sort of straight, but
Mhm.
mine did this whole like almost look like a P, like there's this big ass loop to one side and then it would kind of fizzle out, which is
Oh,
basically showing
wow.
me that like right to left the temperature was like about I would have to look at it, but it was like 2.7 degrees Celsius different side to side. That's like a lot of temperature different from one side to the other consistently,
Wow.
consistently, consistently.
Yeah.
So it's showing me that like my body didn't know how to balance itself, right?
Oh my gosh.
So
Wow.
that was fun.
That was fun. What a fun little thing to
I don't know,
discover.
man. We're not laughing. What are we doing?
Right, right,
Yeah.
right.
I do
Oh,
love a good cry, but yeah. Yeah.
yeah, good cries are, yeah, they're needed.
So you're saying to we've got stage one, and then we've got, tools and homework and things like that if
Hmm.
need be. And then if those
Mhm.
things don't work, you typically send people elsewhere, or are you trying alternative things? What's your approach?
So first thing is just we start with an initial exam to let's just make sure this is actually happening within someone's
Okay.
system. And
Okay.
then, yeah, phase one is okay, let's just start with the adjustments and see how your body responds. And
Hmm.
it's kind of status quo. I personally and professionally believe it should be that if you're trying something for around 6 weeks and it's not working, well, don't just keep trying. Like this might not be the
Right.
solution. So that's why
Yes.
when that initial exam, in that first re-exam is normally around the 6 week mark because let's like check in and see are there
Oh,
any signals to show me this is working in your system. Because I can't decide what gets healed first, right? Like
Sure.
if you have chronic constipation and migraines and can't sleep, and in your mind, and it totally might be not you, but the proverbial you, it
mhm.
might be like, dude, I only care about these migraines. I can't decide that your body doesn't first work on digestion and sleep. Like I can't choose your body's priority for it, right?
Okay.
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 So after phase one, it's what other tools might we want, or what other homework might we want to help with what actually is living front of mind for you, if that's not what your body decided to prioritize first.
Right.
And then and yeah, I would be literally lying to you if I sat here and said, oh my gosh, I've never had a patient not get better. No, I've had like three. Have noticed like no changes. And I do think about them all the time. But anyway, so then it's finding out like, what are you gonna do, man?
I
How am
yeah,
I supposed to not think about them?
of
2 points
course.
on this. One, I
Oh.
also know for each of them that they were going back to home lives that like weren't safe situations.
Oh
Now,
Mm,
in
gosh.
what world could I override that, right? So it's
right.
almost like
Right.
not saying they didn't
Right.
still need to be in my office, but also it's like there are stronger variables at play.
Hmm.
Um,
Of course.
and
You can't
then
control those things.
right. And then for other people it might be like do they need a do they need a different referral? Like maybe one of my favorite things to see is sometimes people might
Okay.
now actually feel like, you know what, I actually think I am ready to sit down and talk to someone. Whereas then they might not have even felt like they were ready for that to begin with.
Okay.
Yeah.
That's one of
Yeah.
my
Okay.
favorite ones.
Sometimes you need
Yeah.
to try almost every outlet and then you get to that breaking
Yeah.
point, I think. Here's
Yeah.
another question I had for you. It's kind of almost an either or thing, but I guess the question would be, are there any myths about your line of work that you'd like to debunk?
Hmm.
Or if you'd rather go a different route, what are some things that you wish more people knew about your line of work? You can
Oh,
take it either way.
Caitlin.
What
Oh,
are
Caitlin,
you
I
gonna
am
do
a
with it?
chiropractor. Um, I'm trying to decide how controversial I want to take this one.
Go as controversial as you like.
Nothing's off
Whatever
limits. I'm
you
talking
do.
blunt.
Okay. So one of the things we talk about, one of the things I go over in my like informed consent to care, especially because I am working with like the brainstem level, and one of the most common, probably the most common, like, hey, also I heard this, like, can we just talk about this real fast, is like risk of stroke, right? Um, two things for
Oh.
two things for that. One, this is also literally why I do imaging and why I like do a very thorough case history. When people sit down with me, we're going to sit down and talk for about like 30 plus minutes. I know you might not know why your sleep matters in regards to the raging migraine you have.
Mm-hmm.
However, I want to like cover all the pieces of the puzzle so that if you come in on a day and the math isn't mathing and things are looking different, I would know
Hmm.
to be like, hey, I'm not adjusting you today. The migraine's not the issue. Like things are changing in a not good way. That has never happened. But like
Yeah.
I need to know the warning signs and what your normal looks like right now so that if
Hmm.
something were to change, then I can refer to you to the appropriate avenue, right? So
Okay.
stroke is one of the ones that comes up. So two things. One, that's always why I always do imaging and I want a deep understanding of what your daily life looks like.
Yes.
And two, quite literally the risk is actually between 1 in a million and 1 in 2 million when we talk about when the only variable is a cervical manipulation, like a cervical adjustment. What is more common that happens is someone will come into a chiropractic office who, and I'll just say it, doesn't have the proper systems and due diligence in place to actually
Mm-hmm.
like give the respect and reverence to this area like they should.
Hmm.
I hesitate to say what I'm about to say, but I'll still say it. I would not get my neck adjusted by many chiropractors unless this is the main thing they did. because
Okay.
it's so sensitive.
Yeah.
And so when you run into like when you walk into like a little like one-stop shop, you know what's your complaint? I'll adjust you right now kind of thing. Are we potentially inviting ourselves to be in situations where like the warning signs of a stroke were already there and then you chose to get adjusted mid-stroke, but now the
Oh,
fault's gonna lie on, oh, I just saw a chiropractor? Right, okay.
Oh,
The fault is at the chiropractor for not pausing and taking note that, hey, something's already going on within your system. There's already
yeah.
a red flag. But unfortunately, and I can totally understand it from like just like a medical fault standpoint, like when you go to the hospital and you say, I don't know, I just saw a chiropractor, that's what they're going to land on, as opposed to like, yeah, but I had this facial and arm weakness and this headache and this, and I was throwing up
Right.
beforehand. That
Yes.
doesn't tend to be part of the dialogue.
Okay.
So
oh,
there's that. For someone who I only adjust the neck, like I don't adjust anything lower, so that's my most common misunderstanding, which I do understand. But
Okay.
there's a lot more nuance to that fear than I think people know.
Yeah. Wow.
Yeah.
Do you feel like that's why, in a way, there might be a bad rep for chiropractors when somebody had a pre-existing condition and that chiropractor didn't do their full due
mm,
diligence, and now you have really both of them who are responsible? Or what? How
I
do you look
mean,
at that?
I think that's a factor to it for sure. I also
Mm-hmm.
think it starts getting political, as many things do. Like if we look to the late 80s,
Okay.
early 90s, there was a case that was the American Medical Association against certain chiropractors, and when we start looking at, we actually won that case because they were found guilty for defaming the profession, because they were trying to get us for essentially practicing medicine, which we obviously don't do. But if you're inherently working with the nervous system, it's going to impact other parts of the body. So your
Yeah.
digestion might improve, your sleep might improve, your hormonal health's going to improve. So I could see how, sure, you might not be coming to me for back pain. Um,
Right.
but I also am not claiming to treat your IBS. I'm just explaining what will happen if we get your body out of a chronic fight and flight state. So there's like a little
Okay.
bit of fear mongering history to it, and a little bit of
Mm-hmm.
like, hey, don't take my patient's history is what it feels like if you were to ask me.
Yeah. Oh, that's
So anyway,
yeah. Thank you for sharing that.
you said
Yeah.
I could go there.
And I'm so glad you did. I'm so glad.
absolutely.
Yeah.
It's actually I rarely address either of those two things legitimately. So I guess you caught me on the right day.
I
Yay.
love
I'll address it
it.
one-on-one in the office all the time, like with my people, but I very rarely like publicly address either of those two things. So
Okay. Well, it is very
yeah,
appreciated.
yeah, of
Yeah.
course.
Absolutely.
And it also sounds like, Sarah, for people who are listening, let's say that might be new to chiropractic care, when they're
Mhm.
seeking a chiropractor to work with,
Mhm.
make sure they do imaging and x-rays and the
Mm-hmm.
necessary things instead of just
Yeah.
crack. What is it? How does it go? Crack.
Snap, crackle,
Anyone?
pop.
Thank you. I'm like,
Unfortunately, I did know
anyone?
exactly what you're talking about. Yeah, 100%. And I mean, if you're going in to get like your hips adjusted alone, okay, the risk is like nominal. If you're looking for something neck care, migraine, etc. related, no, make sure they do imaging and proper testing. Yeah.
Mm-hmm.
Gotcha.
Okay.
Okay.
Yeah.
Good to know.
Yeah.
Yeah, because I think a lot of people just don't know what to expect if they've never,
Yeah.
and that's understandable, of course,
Mhm.
but they're it's just whenever you're doing something new with your health, it's always like, am I doing this right? Is this
Right.
person really, is this the route I want to go? That sort of thing. So any
Yeah.
little bit of information
100%.
helps.
For
Well, I
sure.
think I always, before someone even comes to the office, I always hop on like a 15-minute consult call, just a free call. Hey, let's just chat. I want to hear about what
Okay.
even made you think that you might need what I provide. And then
Hmm.
also like let me share about the process, but also like what are your concerns already? Like, are you already nervous? Have you heard X, Y, and Z? Have you already been to a
Mhm.
chiropractor? Have you stayed away for certain reasons? And so I think I would say most practitioners will do something like that. And so if there's an opportunity, like if you're searching in your area for upper cervical care, find one that is willing to hop on the phone with you first and really like listen to what you're experiencing and honor any concerns you might have. Because first of all, that's already going to show you right there if they actually care, right?
Yes,
Absolutely.
absolutely.
And then that's, I would say that that's the first thing to look for. And then yeah, like I said, look for someone who definitely does some sort of imaging and some sort of like nervous system testing.
Okay. That's really good to know. I was just thinking, Sarah, is there a patient story that stands out to you from beginning to end in your treatment program that was quite transformational. Do you have a patient story you're able to talk about, or any kind of patient story you feel like is
Yeah.
worth talking about? Yeah.
I mean, part of me is like, oh my gosh, which one do I pick? I'm not even gonna lie. I was like, oh, they're so exciting.
Oh, I love
But
that.
one of my favorite things, I'll share like one story and then one snippet. We'll start with the snippet. One of my favorite things is when someone first starts care and you can tell that they like, first of all, and this is so understandable, they've probably tried many a things and they've probably had the
Mhm.
world promised to them many a time already, especially migraine patients tend to be like the top one who like, they're like, look,
Yeah.
I'll try again, but I don't actually think that I trust this process yet.
Yeah.
And then
Mm.
it's like 2 or 3 visits in, and they're like, "Hey, so by the way, I just had 3 really good days." And they're like, you
Oh,
like see them be like tiptoe into excitement because
tiptoe.
they're like
Amen.
starting to see like, "Oh my gosh, this actually might be working." And that's one of my like favorite
Oh,
things is when you can see them like start opening up and gaining trust. And again, back to square one of like you see people become like more vibrant versions of themselves. Like that right there. Wow. I'll do that all day, every day. But
mhm.
actually, one of my like favorite patient stories was one that like, dude, took us a hot minute to like quote unquote get it right. It was
Mhm.
a male patient. He was in his mid-30s. I saw him when I worked in a different city, and he was like a gastroparesis patient. So like his stomach would basically be frozen and like really hard for him to gain weight, really hard for him to digest food, pretty
Oh,
intense
wow.
anxiety. Which again, if we're talking about like sympathetic dominance to where our body's like stuck in fight and flight, the opposite of that is rest and digest. So we tend to see like gut shutdown, like gastroparesis, accompany that
Mm.
pretty commonly.
Mhm.
Or it's the opposite and it's overactive gut, like IBS. Okay. So I worked with this man I actually think we worked together for about a year because after his initial phase of care ended, he did stick around for like monthly check-ins. And so
Okay.
when I was moving out of this city, we were just going, we were like reviewing all the progress. And I had known that we'd made some progress, that his panic attacks had reduced, that his stomach was getting better. But I, at that point, didn't feel like I had just changed his whole life. I was also pretty new in my like career at this point. And then we're like sitting down going over like our whole experience together and he's like, "Yeah, I've like gained 15 pounds in the past 6 months. I drive like driving was a big trigger for him. Like I drive without an issue now. I also I'm talking to my dad again." And I was like I was
Oh.
like I literally was like, dude, why couldn't you have told me any of this sooner? And obviously, like we did talk about it, but I felt a little bit blindsided because I don't like rehash someone's whole case every single visit, right? It's kind of
Yeah.
like what's top of mind today. But it was one of those like I
Right.
don't even know that I understood the depth of like the way that this was impacting his whole life, which I know it can, but I don't think,
Mm.
especially as a newer doc, I was like, oh my God. I was like, thank you so much for like pausing and like knowing that I was moving and like making sure I understood the whole role that this played in your life because I think I knew it did
Wow.
something good, but it was one of those cases where I was like, oh, I kind of wish I had done better, quote unquote, as if I'm the variable. I'm not. Like the body's doing all of the healing, but
Yeah.
I was like, oh my gosh, this is so cool. Like, because in my mind, I'm like, right, that's what I should expect. Like, that's what should happen.
Mhm.
But I don't know.
That is
It's like,
so cool.
it was a fun moment.
Absolutely. How
I
That
got it.
meaningful.
I got a text the other day from someone who is newer in care. I almost don't like when someone starts doing so well from day one because then what's going to happen is healing's not linear, right? They're going to start doing poorly again. It's just part of the process.
mm,
Sometimes, and one of the
yeah.
main things is sometimes because the body now has more capacity, so now it's like, great, let me process some shit that I haven't for a while, and so they start
Yeah.
flaring. And they
Right.
come back in and they did need adjustments. So we got them adjusted. And like I checked in with them a couple days later and I was traveling. And like they ended the text message with the very cliche, like, thank you for giving me my life back. And I read that and I was like, yeah, I'm good for another month. Like you know what? That's all I
Oh,
needed. So
that's
it's like, how can I
incredible.
not sit here grinning like a fool when I get the privilege to
Yeah.
just be the conduit for this, you know? So
That is
Yeah.
so
Oh, how
incredible.
does that answer your
beautiful.
question?
Yes,
Oh
thank
my
you.
Okay,
I love that
cool.
goodness.
so much.
They say
Oh,
find your why, find your
Dude,
purpose in what you're doing. Honestly. Oh, that's
yeah.
beautiful.
And like if we, I mean, don't get me wrong, if we had more time to hear all of the nuances of just my personal life, I would tell you all the things that are going wrong in my life right now too, you know? So I just went through a breakup. I'm only a year into business. I'm barely paying bills. But then these are the things I get to say, and I'm like, none of that matters. Like literally none of that matters.
it's
So
almost like
anyway,
you're saying it could all coexist
Yeah.
at the
Oh, what a
same.
concept.
Yes,
Yes.
I know.
Yeah.
Right?
Yeah.
Yes.
Yeah.
And
Yeah.
yeah, so when you are, Sara, helping your patients go through that process where healing is not linear and they're going to have their ups and downs, and I imagine you might have to coach them a little bit throughout that process and remind them it's very much part of the process, even though you may not want to hear that,
Yeah.
you know, because like you're not just getting them to like maybe start talking and taking action, you're kind of helping them to get back in tune with their bodies,
Yeah.
which is huge for people who've been disconnected from their bodies for so long, as someone like yourself would know.
Yes.
So like it's not
Yes.
just talking. I mean, you know, once we get to talking, right, then we're talking, we're taking action, but like
Yeah.
to be in tune with our bodies again, I mean, that's huge. They'll have that for the rest of their lives. So
Absolutely.
that's amazing.
I I don't think about that often enough in the sense of like, thank you for saying that because I think that that is
Right.
absolutely a beautiful part of the process. Like it's almost a side effect of it, so to speak. Because
Yeah.
again, if I'm predominantly looking at what does the brain do when it feels the need to protect, and is there something physically keeping us in a protective state? Disconnecting from our body is a very protective state.
It is. Yeah.
If I don't feel what my body's feeling, how could I be stressed about it? Right?
Yeah. Yeah.
So, and I kid you not, like again, that was part of the conversation with the new patient this morning. They were like, sometimes I notice that I have to pee. Other than that, don't ask me about my body. I was like, great. That actually, you're in the right place probably. There's probably more layers and they have
There's,
other support, right?
yeah.
And like that is such, and especially as women, like we're taught, if anything, to do the opposite than listen to our bodies, whereas our bodies are so ridiculously intelligent. They
Mm-hmm.
are like so beautiful and so well connected within themselves. But we got to get out of like the frontal lobe in the mind to be able to like be one with self. And I think
Mm-hmm.
that obviously there's so many, yet again, there's so many variables and whatnot. And doesn't that make sense that we would want to disconnect from self
Yeah,
if we're stuck in a protective state? Yeah.
Yes. Absolutely.
absolutely.
Yeah, for sure. Wow. That's so
This is what I'm
cool.
going to talk about all the time, guys.
I
So come
love
hang out whenever you want.
I would love to. We both would love to. Oh my
Perfect.
goodness.
I get to see Virginia at least a couple times a month. It's great. It's never enough, but at least like 2 or 3 times. So I'll take it.
Oh, it's
Yeah.
so great. Well, I
Yeah.
definitely want to talk about, we're good on time, but you know, Sara here is not just a rock star chiropractor. She is very much a huge part of the community here in North Idaho. So thanks to her, we have our mindfulness monthlies.
Mm-hmm.
I'm going to let Sara talk a bit more about that. And she's also going to, she's working on conducting a series of workshops so more people like ourselves can learn about all this. So,
Yeah.
Sara, could you tell us a little bit more about your community work here?
Yeah, of course. Thank you for asking.
Yeah.
Well, and one of the main things is, yes, I'm working with individuals one-on-one, and also like I say this almost every mindfulness monthly, which I'll share what that is in a moment, but like healing happens in community. Like we are not meant to be isolated individuals. And so one of the other ways that whether these people ever become my patients or not, when I say I don't care, I really mean I don't care because I understand the people who are supposed to land in front of me in my office, they will.
Yeah.
So I host they're called Mindfulness Monthly. It's always free. It's once a month and it's a mindfulness based activity. So every other month is a sound bath and then the other months are like a guided meditation or breath work or yoga nidra. Um, yeah, I said guided meditation already. And so we
Mm-hmm.
kind of start with the first 20, 30 minutes or so. It's just like arrival time, but also like I'll have some non-alcoholic and regular alcoholic, like Prosecco. And I encourage people like, okay, it might be a little uncomfortable, like talk to the person next to you. Because at the end of the
Yeah.
day, we're all living in the same community here. And I
Yeah.
mean, especially, I feel like we're going to be saying this for the rest of our lives, but especially like in a post-COVID world where we had to like relearn what community means. And also, when you don't have something, you learn how valuable it is. But my hope is that friendships are formed and connections are formed and people start recognizing each other as they come back month after month. And so, yeah, once a month I host that kind of mindfulness community event. Just here in the office, we scoot all the chairs one out of the way. I ask people to bring a yoga mat. I'll have a couple like extra blankets or so if they forget. And we just spend like 1 hour together. It's just an hour-long event. And so yeah, there's that community time at the beginning, and then there's 30 minutes or so of the mindfulness activity, again, sound bath, meditation, breath work, etc. Because it's also about, those are some of the main tools, maybe not main, but some of the most popular tools that people either might need along their journey with me, or it's something they
Yeah.
might already be doing because they're starting to learn about mental health, physical health, vagus nerve,
Mhm.
and mental health. And like, what are some of the most commonly like trendy, dare I say, things that someone might want to try? And so it's an
Right.
opportunity for them to try that and see how it lands in their body. And also,
Yeah.
I feel like so often they're I mean, okay, let's be honest, my care in this office, like it is an investment, right?
Hmm.
And again, when you're talking with people who have struggled with vertigo or migraine or POTS for 15, 20 years, they're like, 450 a month, got it, whatever, that's fine.
Yeah.
Um, because they're like, I've shelled out far more for far worse results. But I also
Hmm.
think like there are so many ways to help support someone's nervous system, and so it's really important to me that at least something I do is really accessible for anyone. So those will always be free. Like come and just spend
Oh.
an hour with yourself and with this community. Because I also think, and predominantly women come to these, and so often we put
Hmm.
ourselves beyond last. We're like last of last off the priority list of what we spend our resources on in any way. And so it's this invitation for people to sit with themselves and sit in stillness and be proud of like prioritizing themselves for an hour a month. And then from there, I did like this nervous system 101 class a couple months ago now,
Hmm.
which is crazy.
I
And
know.
and that one was smaller. That was only like 8 people or so, and that was truly like more like educational. And so that was like me
Hmm.
talking to the room, right? And so that was just an overview of when I say nervous system, what do I even mean? Because I think there's so much conversation about the nervous system, but we also don't realize it's quite literally a structural part of our body. It's our brain and our spinal cord and all of the nerves that expand out from the spinal cord. Like that's what we mean when we say nervous system. Now,
Yes.
is whatever state or mode your nervous system is in going to impact mental health, physical health, et cetera, 100%. But like the nervous
Hmm.
system is a real structure within the body. And I think sometimes around this conversation around this online, we kind of forget that like it's a real thing. And
Yeah.
so we talked about that and we talked about like, and now in what way do I support it? And we just had, I feel like the questions, people were like really getting it. And I was like standing there, talking to 8 people in like the waiting room. And I was like, this is so freaking cool. And
Yeah.
if there's the interest in it, I would love to do this like nervous system. And so we're starting like a speaker series, and if it resonates I'll keep doing it. If it doesn't, okay, I won't. And so our first episode, not I guess not episode, our first evening is in a couple weeks, and it's sex and the nervous system. Because
Yeah.
again, I was like, screw it, let's just start with a bang.
I
Because I
know.
think we can, we can, no pun intended on both of those, that's so
I
I
funny.
was
was
gonna
saying,
say.
what kind of thing?
But I think so when we talk about the nervous system, it is simply going to inherently impact every part of our life, including sexual function, pleasure,
Hmm.
anything and everything. And so this is where I'm bringing in other professionals and experts in the field. And so I have a pelvic floor
Yeah.
OT and a sex consultant. So it'll be the three of us. And we're picking some of the most commonly asked questions as it pertains to sex and the nervous system. And we're speaking to, like, we're each answering one of those questions from our lenses, from our lens.
Oh,
So it's
Yeah.
like, so it might, the first question might just be like, how do the nervous system and sex even correlate? Okay, so well,
Hmm.
and again, we can do a whole other podcast episode about that if you want. But it's
Oh,
like,
yeah.
or it could be like, why is it so hard for me to climax? That's a really common
Hmm.
thing. Or why don't I feel comfortable? Or and there's so many different
okay.
questions. So I'm really
Oh,
looking forward to that.
I'm
Um,
really excited for that one. I think I'm
I
hoping to
know.
see like women be really comfortable with asking questions maybe they've never felt comfortable with asking,
Hmm.
because healthy sex is a huge part of a woman's well-being, and I don't think
Amen.
that gets talked about enough in a way
Hmm.
that's actually um, positive. And
Yeah.
it's a good thing. It's a really good thing. It's a huge
Yeah.
part of our functioning as
Right.
human beings, as women. So I'm really excited for this one. It should be really good.
Well, I'm glad you shared that, and I intend on when it gets a bit closer to the date, I'm going to send out a message to everyone who's RSVP'd and give them the opportunity to share what questions they might have now, so that we can kind of pre-program them in case they
Nice.
don't feel comfortable verbalizing that in front of other people, right?
There
Yeah,
you go.
Um,
Yeah.
great.
because there's so many. you have cultural and religious implications of how they feel
Mm-hmm.
about sex. You have potentially past trauma. So there's so many different ways that I want to be sensitive to that subject. But I'm very excited
Absolutely.
for that.
Yeah.
And I almost hesitate to say this, but we are going to be recording it, and it is like a ticketed event, but so we're going to be recording it with the intent of like having that, yeah, I guess, production for purchase after. The only reason I'm hesitant of saying
Nice.
that is because like if you're in North Idaho, you should just come in person. But anyway, if you're listening to this from Ohio or so, that will be something that we do intend on like having available for people. So that's
That's
exciting.
really
And then
great.
yeah, and then from there we'll see. Like I would love to do an episode of migraine in the nervous system, vertigo in the nervous system, menstrual cycle and the nervous system, whatever it might be, and just continue to bring in other local professionals and experts to like really speak to their knowledge on the subject. So I'm really
Mm-hmm.
excited for that. I think that will probably be more like quarterly than monthly. But
Okay.
again, one thing I learned by doing that kind of nervous system 101 class a couple months ago is, as if you couldn't tell from this podcast, I love sharing about this. Like this just, yes, don't get me wrong in the least, the hands-on work, the like one-on-one hands-on work. Oh my gosh, when I come into the office for an adjustment, like a patient block, quite literally all of a sudden I'll look at the schedule and be like the last patient, and I'm like, what just happened to the day? Like it flies by, and and also that's like I have a limited amount of dare I say like lives I can impact doing it that way.
Yeah.
And like, no, it doesn't replace what I do hands-on, but also I think just having these conversations and educating
Mhm.
women in particular, but educating people about how their bodies function, how their brain and their mind are connected, just about some myths and misunderstandings about the nervous system. Like this is my why.
Mm.
This is why I'm here. And so it's
Oh,
exciting to have more opportunities to do that.
we're so glad that you are here and doing this.
I wish I could
Yay!
hug you two right now. This is silly.
Virtual hug.
Virtual hug,
Yeah,
virtual hug.
perfect.
Oh.
Yeah.
I was gonna say, and I think you touched upon this, but I was going to ask you, is that kind of what has inspired the Mindfulness Monday and then these, blank and the nervous system because you just want to reach more people, or how did your brain kind of come across, putting these together?
Yeah. I'm like figuring this out as I'm answering this question a little bit right now. Part of it's because I just understand that like we need each other. Like that's where healing happens. And so part of it is that
Mm-hmm.
like healing happens community. And I mean, it, there are so many layers to like the way we co-regulate, the way our brains respond to each other. Like we have all felt the difference of when we walk into the room with like our safe person or walk into the room with someone who is not a safe person, and we feel that in our brain and our body. And so part of it was just the clinical understanding that like this will benefit everyone, including myself. I
Mm.
want a sound bath once a month. Oh my gosh,
That
yeah,
sounds
you know.
amazing.
And then part of me is also like I'm a solo practitioner. I own my own practice, and it is very much like how can people learn about who I am and what I do without it just being like lunch and learns or fairs or
Sure.
whatnot, which can totally serve their purpose. However, I that's not my style. And so
Yeah.
I was also just a way to start introducing myself to the community and within the introduction to the community, like creating not quite my own community, but our own community, because
Hmm.
I think that it only helps if you also know and resonate with your practitioner. And especially if I'm working with someone for 6 or 9 months or even a year, we're going to get to know each other as humans. And I think
Yeah.
step one, and especially when it comes to working with so many anxiety patients, part of that might just be like, okay, now I like know Sara and she's pretty cool. I think I could trust her with my health. Like it is very much a stepping stone process. And so giving
Mm-hmm.
people
Yeah.
the opportunity to just get to know me as a human and like get to gain that trust again, whether they're supposed to be in my office or not, not the question I'm asking, but giving people the opportunity to create community that they might be lacking. And then also just get to
Mhm.
know me, you know. The only other career I ever considered was being a journalist. So I really like connecting with people and like talking to people and hearing their stories. So I think it's also like fulfilling that kind of dream of like just hearing other
Yes,
people's lives.
Oh
that's
yeah.
amazing.
Yeah.
Oh, that's so cool.
I
Yeah.
think you honestly, one, it's so much more meaningful than just saying, here's my card, call me, call, or make
Yeah.
book an appointment if you want. Like you
Hmm.
are connecting, and to your point, we absolutely need connection. I think that is a common theme on pretty much any episode we've ever done on Talking Blondes is the importance of connection and community, regardless of what we're going through. So I think it's so beautiful, Sara, that you're saying they may not become patients. It just might not even be in the cards. That's okay. But wow, how powerful to just want to make a difference, but also, just make friends along the way and just
Yeah.
enjoy, where you're at in life. So
Yeah.
that is a beautiful thing.
I think, maybe it's because I have boomer parents, but I'm like, I would rather enjoy the journey than like speed my way to an outcome. And
Yeah.
it feels so nice to have worked for so long and be like, oh my gosh, I actually love my daily life. This is
Oh.
that, like, I privilege in multiple other ways, but like that right there is my biggest privilege is like every day I wake up and I want to, and I get
That's
excited to like
beautiful.
come into work. And then I go home, like right now I'm like, oh, it's 5:30 already? What in the world? That flew by. How cool is that?
Wow. That's so cool and such a beautiful, meaningful life. That's so beautiful. Wow.
I mean,
Sara, where can people find you?
mhm. So on most social medias, predominantly like Instagram, but also TikTok, Facebook, YouTube
Okay.
even, Dr. Sarah Zwink, so DrSarazWink. That's my
Okay.
handle. And if it's not my handle, it should still pop up because my last name's pretty unique.
Yes.
And other than that, I am in the middle of a rebrand, so the website's down, but Coeur d'Alene
Yeah.
upper cervical could be a way to learn about me. But if you search Sarah Zwink or Dr. Sarah Zwink, then you should find me. And again, if you're listening to this and you're not from the area and you have questions, oh my gosh, please just DM me. I hope that comes across that like I would love to just chat, even via messages.
That's
Like
awesome.
I might not respond the moment I see something come through. I might not even see it the moment it comes through, right? But like
Yeah.
I love to respond to people halfway across the country and be like, oh, maybe I can help you find
Oh.
someplace in your area because I'm not the only person who does this.
Well,
I just,
that's huge.
I love your energy. I love your knowledge, of course, but I love that it's clear you just have such a big heart and you are just wanting to use your expertise and your gift for connecting with people to just give back. But,
Yeah.
I know that sounds super corny. I don't mean for it to sound all
Yeah.
hallmarky and everything, but we need more of that. So I am just so happy. And the fact that you love to talk to people, you came on the right show. So
I'm a big believer in, I guess, just the laws of reciprocity, and it seems to be working out pretty
Mm.
well in my life. So why not
Oh,
just keep pouring out the love? Because I just feel like the more I pour out, the more I get, and so it's a win-win for everyone.
yes.
Yeah.
Oh,
absolutely. Absolutely.
well, we
I'm
so
so glad we
appreciate
did this.
it, Sara.
Yeah.
Thank you
Me
so much.
too.
Yes.
We
Yeah.
will definitely include all of Sarah's info in our show notes. Anyone
Yes.
listening or watching, be sure to check that out. Make sure you check out her on social and website amid the rebrand, all that good stuff, or just
We'll get
Google
there.
her, whatever. But we are so delighted that you could join us today, Sarah, and I will be messaging you, I'm sure. So I will
Do
be
it.
updating you on my own little health journey and everything. But
Oh,
Perfect.
and I'll be watching some of these, blank and the nervous system. I'm
Hmm.
pumped that it's going to be accessible online, like eventually.
Yeah.
So I'm ready. I'm a fan
Perfect.
already.
Well, I mean, Caitlin and Virginia, thank you so much for inviting me and then being so, I mean, yeah, we just chatted for like an hour and 40 minutes. That's wild. This
I
also, again,
know.
my speaking of jaw pain, I feel like my mouth, my like jaw is like sore from smiling this whole time. And let me tell you what, that was not a Miss Congeniality smile. I literally just been grinning here chatting about this. So thank you guys so much for this
Aw.
opportunity to both get to know, I guess I know Virginia, but to know Caitlin a little bit, and then also just share this with anyone who does listen, because I think that I mean, like you said, I really do have a heart for sharing this, and I've seen firsthand how impactful this can be when people understand their own bodies better.
yes.
So thank you.
Oh. All right, ladies. Well, we'll see you guys on the next Talking Blondes episode. We have other guests as well. So, Sara, thank you again, and we will see you on the next episode.
Thank
Bye,
you.
everyone.
Bye.
Bye.
Bye.